This morning I'm talking to Liz Ranger, and I've met Liz through networking because she runs a small business now, but she spent 34 years in nursing. And I know many of our students are interested in that profession. So Liz is going to share her thoughts around that industry. So Liz, thank you very much for your
You're
time this
very
morning.
welcome.
A lot of our young people are interested, as I said, in the world of medical, and because they can't currently go out and have those work experiences and maybe volunteer in the hospitals, the things they would have done to give them an insight, this is a really good way of them hearing a bit more about it. So you've, with 34 years experience, you know, you can really talk about it. So can you tell us a little bit about a typical day in the life of a nurse?
Okay, yes, absolutely. And it's a really interesting question because obviously over 34 years, I've worked in lots and lots of different places. And I actually made a little bit of a list. I started off working in hospitals and in wards. I'm a children's nurse, so that's predominantly where I've worked. So unless you've been in a children's ward yourself, you probably don't realise it has a massive playroom and a schoolroom, so a very different kind of environment. But then I've also worked in the community and in health centres, but also going out into people's hospital ward. It's not always as, as sterile and clean as you would expect to be, because it doesn't need to be, because it's someone's home. I also worked in a call centre. So if you've ever needed to call a 111, I used to work for the NHS Direct, which was before 111. So I've worked in a call centre as a nurse. I also used to come into schools. So I wasn't the matron in the office when you've bumped yourself or you've hurt yourself. I was one of those ladies that probably came in and gave vaccinations or came and spoke to pupils about health concerns and things that they had. So nursing has given me a really varied lots of options, whether you're working with different age groups, different types of illnesses and different types of setting. But a working day is pretty similar. It's about providing care and advice and support for whoever you are or whoever you're with. But when you're on a ward, the day does tend to run around meals. So it's sort of helping people get up with personal care and having their breakfast, then their dinner and their tea. But in that time, you're looking at getting that they need, and sort of tying it in with doctors' rounds and medications and all of those things. So it's a ward day is very much structured around sort of meals and bits that fit in between. But obviously the patient is
the most important. Yeah,
most
absolutely.
important person. Yes, absolutely. And it should be patient-led care or person-led care. So it's really important. But to put into a small nutshell, because it's been just an amazing career of 34 years with so many different opportunities.
Absolutely. And that, I think that's an important thing to get across to young people, isn't it? That once you've qualified in nursing, there's so many directions you can go that, depend on what you're interested
Absolutely.
in,
Lots of
what you're most interested in. So what took you down the kind of children's and schools and that kind of route? What sort of interested you there?
I've always wanted to be a children's nurse, and when on a degree course, you didn't have to go to a degree, you went to a hospital and trained. So I trained at the Westminster. I was very, very lucky. I lived right in central London by Big Ben and all of those amazing places. And it was just, I particularly like working with children. I'm sure sometimes we've been to a doctor or a nurse and we've had something done and it was uncomfortable or we didn't like it. And as adults, we're very much like, oh, yes, done kind of thing, or we put a very brave face on. The child will tell you you're hurting them. They will tell you that. And it's how you manage that and, in those skills and that work that you have to use with distraction, with the medications, with perhaps magic cream and things that can be used to ensure, and just explaining really. So I really liked that working with children, and it's always a little unpredictable, but that's what I liked about it, and if I had to get a child walking, I would jump on a tricycle and ride down the middle of the ward. I wasn't the most conventional ward sister, because And then if the child tootled along behind me, I'd achieved what we needed to achieve to see. So, yeah, I had a great lot of fun being a children's nurse.
Mm. What I'm interested in is, obviously I don't work in that field myself.
Yes.
People die in
Yes.
hospitals. Young people who are thinking about nursing potentially, but thinking, what's it like when you're dealing with those situations? How do you cope with being a nurse and dealing with people dying, or speaking to families, that kind of thing?
Yes, I would say it's something that you learn. You know, obviously, when you start as a student nurse, you're very much supervised and cared for and supported in that role. But it is something that you can see very early in your career, because, you know, you can't be completely sheltered from it, because it's nursing and it's also life. Um, I think the thing about death and things like that is all about dignity and making sure that people have that respect, and also about caring for family. It is, you know, a very difficult time. But as a nurse, you know, I can't say that I've never shed a tear. You know, you aren't hard, you aren't someone that's uncaring, because you wouldn't probably be doing the role if you were. And I think it's just about making sure that you access the right support networks that are there for you at the time. And, you know, nurses are quite practical people, and sometimes that you get into a practical mode to just help you get through what you're doing. So yes, you know, I can't say that I haven't seen children die. I've seen adults die, and but it's about that understanding that you've done everything that you can for that family.
Mm. Mm. That's really good to know, and that's, you feel that there's that support there for you
Absolutely,
in
yes.
the NHS if you need
Yes,
it.
yes. And I would say, you know, particularly more when you're training and your student phase, there is a lot of directed learning to ensure that you can access and get the right things that you can.
Excellent. Yeah, because it must be difficult to compartmentalize when you've got with something very, very sad. But as you say, the fact that you're actually helping support people must make you feel really good, even when things
Absolutely.
don't always work out.
Absolutely, yes, that's right. And I think that's what took me into nursing. It's about meeting people. So even though I was a children's nurse, you know, children come into hospital, their families and parents come in as well. You know, and I've met so many interesting people, because health doesn't discriminate. It doesn't just hit one kind of person, you know. So I've met very different people, and everybody is impacted by their health, whether it be physical or whether people's lives, their families, their jobs, their pets, and how that illness that they have impacts onto them. So it really is about making sure that we're actively listening. And they actually do say that to actively really listen, and the person know you're listening, you should know what colour eyes that person has. So it's from that point of view, it's very interesting to sort of not be staring intently at someone, but making that eye contact that is meaningful to that person. And as a nurse, you're trying to make sure that you're getting the right information for the symptoms or the conditions, or how it's impacting onto people, or what medications they're taking. So you really have got to listen so that you can plan their care as well. And I would also say that you listen with your eyes as well, because you know, you might ask someone about their pain, and they might say, oh, it's fine, but they're sat like this, they're rigid, and they don't want to move. And, you know, they might be saying what they think you want them to say, or I've been trying my medications, or I've been doing things, but actually their body language is telling you that they're sitting because they don't want to move, because they're afraid the pain's going to hurt. So from that point of view, it's just really important to be a really good listener. And it shows people you're interested in them.
Absolutely, and that is really interesting, because it is about body language. And one of the things that students certainly have realised over this period is, whereas they're used to being face to face with people and learning face to face and seeing people's body language, and, you know, the body language of their fellow students, of their teachers, suddenly in some cases they might see one person on a screen, but it is very, very different, isn't it, to actually being face to face with somebody. Be interesting to see from nurses and doctors who are trying to diagnose online how that's working for them now.
Yes, and I think you know, I think this will change. Times have changed significantly in the last few weeks and months, and I think you will see more assessments by doctors over Zoom and things like that. It will be really interesting to see. So
Mm.
the second one I picked was problem solving, and I think with nursing we need to be really solution focused. People have come to us for help. We need to help them find the solution. And I sort of broke it down into a little few things. So first we have to help them identify and define what the problem is, and then do a bit of analysis. Now that sounds very, very technical, but it's not technical. It's just thinking about what can we try? Are there any solutions that we can have? What might be best? Then we can try it. But what you always have to do is, as a nurse, is evaluate what you've tried. Has it helped? So I thought I'd come up with a little example of maybe someone having a really nasty sore throat. And it's really difficult for them to eat and to swallow, and it's very, very painful. So obviously it's important that we need to keep them eating and drinking to keep them well. But we know they can sip a little bit of fluids, they can perhaps enjoy an ice lolly or something like that. And we know that when they take painkillers, it really helps them to feel a little bit more comfortable. So as a nurse, I would be planning when they're having their next meal. And I'd be making sure that they're taking perhaps their paracetamol or ibuprofen 30 minutes before that meal, so that the painkillers have got to the right time at the right place. That the meal you might offer them might be something a little bit more liquidy, maybe some soup that gives them the nourishment they need, and then maybe a little bit sort of ice cream or yogurt or something to finish it with. So you would see how well that person had eaten. If you're really worried about how much they're eating and drinking, you would be wanting to record it in milliliters and how much they'd had. And then you're going to look at the solution. Did it work? Did it help? Listen to the patient. So back to our listening skills, and bring those two in together to see if that helped. So as a nurse, that's one little example of finding solutions to problems and problem solving. But I would say that you're probably doing that as a nurse constantly, just little ones, and then every so often a slightly more bigger one will come in. So maybe you're running a ward and they want to admit in a patient, and you need to think about, they need a room on their own. Who can you move out of a room to let that person have a room and be in isolation that they need? So you're constantly problem solving. It's not always a difficult problem. It's just lots of little ones. And then, but those little ones bring you the skills for the big ones. And I think actually people don't think about problem solving as quite complicated, but we do it every day. We do it every day. You know, what shoes am I going to wear today? Oh, I've got a long walk today. I'll put my comfortable flat shoes on. You've problem solved. You're doing it every day, but it's just then how you move it into your working environment as well. So it's really interesting, and definitely a skill that you do constantly.
That's really good to know, because again, our young people, if they're at home at the moment and they're thinking, how can I keep developing myself? When you start to realize the things you do just in your normal life that help develop your skills, as you say, even simple things like, you know, what am I going to wear today, or things that are happening around the house, and it's all about observation really, isn't it, and observing what's going on around you.
Yeah, absolutely.
Excellent. Fantastic. And what's your third, Liz?
My third one is teamwork. So as a nurse, you're very much all as a team working as the positive patient outcomes. And as nurses, we don't work alone. We have doctors, specialists, physios, occupational therapists, dietitians. We all help when a patient needs it to bring to that patient outcome that's needed. So even if we go back to the sore throat, and that was a thing in hospital, you would have the doctor that would prescribe the medication, then you'd have the pharmacist that would provide it, the nurse that would give it, and the nurse that would review it. You'd have the kitchen that would bring the food, and you would help to get that right food. You have to be a good team player. And again, this is stuff people are doing all the time. You know, you might play in a sports team. You know that at a certain time, throw the ball to that guy because he's the one that knows how to get it to the end of the pitch to get the goal or whatever. You know, you instantly learn from your colleagues who's got that ability, that strength. And when you were asking earlier on about, you know, someone dying or something like that, you know, in your team who you can just go to and say, just taking 2 minutes, I just need to just have a breather and just regroup. And you also know that they probably might be feeling the same, and you can support each other. So you get to know people in an amazing different way, and your work colleagues are essential in your team and your working.
Mm. That's a really good piece of advice to give, because I think people just think the word teamwork can sound really sort of trite and a bit kind of weak, really, but actually it's so important. And certainly in the medical world, you've got this whole team around a patient, haven't you? And it's all sorts of different people. And for our young people, it's about them learning you can be part of a team, and different people in the team will bring different things to that team.
Yes.
And will have different skills. And if you can identify as part of that team who to go to for what, teamwork isn't just about how you work with them, it's about how you understand how everybody works together.
Yes, absolutely. And you can't do your role without those other team members around you. It's essential. But what you've got to remember as well is your patient is part of your team. They're part of the team as well, because you're helping them. And it's a different kind of a team. It's not a work team, but it's also part of that team and getting things together and sorted. So yeah, it's amazing how you develop those teams, but also you develop the most amazing friendships. I have friends that I started nursing with back in many years ago, 34 years ago. We go on holiday every summer together. You make amazing friends for life.
That's wonderful. Thank you, Liz. Thank you. Now, we've got many young people who have finished their education, who are now at the point where they're thinking, right, I'm in semi-lockdown. What can I do to enhance my chances of work? Not necessarily just in the medical world, although that's really useful to get your thoughts on. But what advice would you give to those young people who are out there waiting to be able to go and look for work?
And really difficult and hard time for you at the moment, feeling like you're on the pivotal bit of going somewhere and getting started, and it's sort of all being a little bit unusual. But there are some really amazing things that you can do and be looking at. And one of my roles has been, over many years, was looking at lots and lots of application forms for jobs. And I just wanted to give some little thoughts and tips around that. So companies like the NHS or larger companies allow you to reuse your application form numerous times. If you're applying for 4 or 5 jobs because you want to keep your options open, you're not sure which one you want, you can use your same application form. And even if you've had a job for 18 months, it still stays on the system, and then you can reuse it again if you're applying for a different job. Because nurses move around a lot in jobs. It's not one place for one time. You've got so many options, and across the health sector. So I've seen lots of application forms where I know someone was applying for one job, but they've just splattered it to all the different jobs and not thought about, they've applied for a hospital job, but now they're applying for a community job, and they haven't changed that personal statement to reflect. And that can be so, it doesn't just have to be related to health and nursing. It can be so much around whatever. You might be applying for a job in a shop, and you just use your same statement that you applied for one job into the next one, but the next one might be in a hotel. So they don't want to know about what you think of shops. They want to know what you think about their hotels. Always look at the company or the part of the NHS that you're applying to. What's their goals? What's their vision? What's their ambition? Because just even a little nod to it just makes them know you've had a little look and the things. And it's about understanding the job you're applying for and matching it up. Now, interviews are really interesting when you actually get there. And I do wonder whether some people are going to have Zoom interviews going forward. I think it might happen. I think it will. And I've got one little tip that I've been using for many years. And I've got here a picture, I don't know if you can see it, of a cat. I didn't draw it. I pinched it from online. But the reason that I have a cat is that there are always some standard questions you will be asked. Now, I'm actually not even a cat lover. I have a dog. But they will always ask you, what strengths do you think you can bring to the job? So cat is my little membrane for my 3 strengths that I always want to share. So my first one's around my communication. I want to talk about active listening. I want to talk about how I feel that I can communicate with people well through talking to them, through written things, through my notes, through my reports. The second one is about being being approachable. So I like to think that anyone in my team could come and speak to me, that, you know, I've always got a bit of an open. If people know that I say, actually, I can't speak at the moment, that actually I really can't speak at the moment, because any other time they know I would be able to help them. And the third one is about being that team player. So that's my CAT, C-A-T. It's just little things that you can prepare now, that you can have in your head. So when you're sat in an interview, and we all know, and it's all happened, or you're speaking to someone, your mind goes absolutely blank. Even though you've practiced, you've probably done it with your mum or your dad or not, your mind goes blank and you think, oh my life, what was I going to say? And instantly you can think, the cat. And you've got 3 lovely strong answers that you can come back to, or you start talking about communication and then you suddenly think, what was I going to say as well? That's only one. What was I going to say? Oh, it's the A, approachable. So I've just found some really little tips like that I've found are really helpful. I think as well, it's about learning things online at the moment, and seeing what's available for you. You know, you might not be able to get out and do something like a caring role or volunteer somewhere at the moment because of lockdown and things. But it's about thinking what you have got. Have you done any caring in the past? How could you write that up in your statement? Have you done anything about customer service? You know, have you worked in a shop? Or have you had good customer service that you would say, this is what I would aspire to be like? Have you been in any community groups where you've already played as a team player because you were in the netball team or something like that? Or have you volunteered? But things like sign language, there's a lot of the British Sign Language at the moment are doing free courses. There's things like online things that you can look at for certain little medical conditions, just to get a start of some knowledge, maybe diabetes or anaphylaxis when someone has a allergic reaction. Why not have a look at doing some first aid things that, you know, you can say, in lockdown, I couldn't get out, I couldn't do A, B, C, and D, but what I did was this. I listened to a lady talk about nursing. I went on and I looked about some different courses about some medical conditions. I had a look and there was a little quiz at the end. And do you know what? I got 18 out of 20. I was chuffed to bits. It just shows you've made a little bit of an effort in difficult times. And no one is going to feel at the moment that we're all in it. It's not like it's just you having difficult times or just me. Becky, we're all in it, aren't we? We're all in difficult times. It's unknown. You know, in 34 years of nursing, I've never seen anything like it. So, you know, it's not a sort of like, you know, people are going to think, oh, they should have done this or they should have done that, because you can't. But what can you do? So keep an open mind, and we'll see if we can get some links that we can get associated to this video that people will be able to have a look at.
That would be great, because I think as an employer, if you are interviewing later in the year and you're speaking to people, you know, 18-year-olds who've finished their academic journey, if you like,
yes,
employers will ask that question, you know, so what have you been doing? How have you been enhancing your CV? Or, you know, because they'll have so many young people available, they're going to be thinking about, you know, which direction do we go? So this is really, really useful for them to start doing some online courses. And I love your cat analogy. I know, I don't know how many interviews I've done over the years, but it's very easy for your mind to go blank.
Yes.
And then you find you're stumbling, and then you feel like you've lost your momentum. But if you've got that little image, whatever it is, students, that you want to create as a little acronym, a little picture or something that just reminds you, I think that's a really, really good piece of advice. So
thank you.
Thank you, Liz.
Yeah, I've been using it for many years. It's stood by me. But I think just to sort of think about with, you know, we're talking about personal development and learning at the moment. So what I said to you was that when I was trained to be a nurse, it wasn't a degree, it was you went to the hospital and you learned. But during my nursing career, I've got my degree, I've got my Bachelor of Science in Nursing. And also I've got my master's in public health. And I was thinking, oh, normally people would say, oh, public health, what is that? But obviously at the moment, public health are giving us all this advice and all of these things. And it's really important that through nursing, you never stop learning. You know, it's learning how to deal with different people, different processes, different treatments. There's so many opportunities to learn. So it's not like you get stuck in one place. I mean, some people choose to work on one ward and they choose to work there for the whole of their career, or that type of nursing. And that's today, so you can say, right, I've done 2 years on an orthopedic ward. Now I'd like to learn a little bit about cancer oncology treatment, because I've seen some people that have had that and I'd like to know some more. So I'm going to go to this ward and learn the skills there about that. So it's a career that just goes on giving, but in the giving to you, it allows you to make a real difference for your patients.
Fantastic. And it is that you never stop learning through life, do you? Whatever job you take, you know, life is always throwing you new ways of learning. So
that curveball that we haven't expected.
Oh, well, we've certainly had that this year, haven't we?
We have.
Liz, thank you so much for all your time today. All our young people in the area, if you want to know more about nursing, we will put some links at the end of the video, and you can speak to your careers advisor. If you're at Shoreham, you can speak to Ms. Silverman. Any young people, go and speak to the careers advisors in your school, or contact the National Careers Service to find out more about nursing as an industry sector. And Liz, thank you very much for your time today.
You're very welcome, and can I wish everyone the very best in their careers. Whatever they choose to do, you will be amazing.
Thank you.